6 things that happen to your body when you masturbate regularly after 70. We're sorry, but this video has come to an end due to a copyright claim from a third party. Please try another one. What does masturbation do to your body? As a senior, is it good or bad? This is a question that many seniors wonder about. Masturbation is a common sexual behavior that can be enjoyed by people of all ages, including seniors. It can be a pleasurable experience that provides physical and psychological benefits. However, like anything else in life, too much of a good thing can become a problem. So what happens when you masturbate too much after 70? Keep watching to find out. Hi everyone, welcome back to our channel. We are here to help you with any questions or concerns you may have regarding your health. And today, we will talk about masturbation and its effects on your body. Masturbation is a common practice where an individual stimulates their own genitals for sexual pleasure. It is a normal and healthy sexual behavior that can be enjoyed by people of all ages. Some seniors, masturbation can be a way to relax and enjoy their own company. It can also be a way to cope with stress and anxiety, as well as a way to improve one's sexual health. However, as with anything else in life, too much of a good thing can become a problem. In this video, we will discuss the potential consequences of masturbating too much as a senior and how it can affect your body. No. 1. Loss of sexual interest in partner. Have you ever heard of the term, too much of a good thing can spoil? Well, this is certainly true when it comes to masturbation. When you engage in masturbation, your body releases a surge of pleasure hormones such as dopamine and oxytocin. These hormones are designed to make you feel good and can be addictive. Over time, your body becomes accustomed to these hormone levels and requires more and more masturbation to achieve the same level of pleasure. As a result, you may find it difficult to feel sexually aroused or satisfied during intercourse with your partner. This can lead to a loss of interest in sex and even erectile dysfunction. Additionally, masturbation can cause a decrease in sensitivity in the genitals, which can make it difficult to reach orgasm during sexual activity. If you are experiencing this, it is important to seek professional help, as it could be a sign of a more serious issue. By understanding the risks of overmasturbation, you can make informed decisions about your sexual health and ensure that you maintain a healthy and fulfilling sex life. Number 2, health issues. Did you know that overmasturbation can lead to serious health issues? That's right. When you indulge in too much self-gratification, it can take a toll on your body and mind. Masturbation can cause physical discomfort such as headaches, fatigue, and even injury. Additionally, overmasturbation can lead to psychological issues such as anxiety, depression, and a distorted body image. It can also cause sexual problems like erectile dysfunction and a decreased libido. To avoid these issues, it's important to masturbate in moderation and listen to your body's cues. Masturbation should be a pleasurable and enjoyable experience, not something that causes pain or distress. If you are experiencing any negative effects from masturbation, it is important to seek help from a qualified healthcare professional. Remember, there is no right amount of masturbation. It is important to do what feels right for you and your body. 3. Weakened muscles. Have you ever wondered if masturbation affects your muscle strength? Well, it turns out that it can. Masturbation involves repetitive motions of the genitals, which can cause the pelvic floor muscles to become weaker over time. The pelvic floor muscles are responsible for supporting the organs in the pelvis, including the bladder, rectum, and reproductive organs. When these muscles are weakened, it can lead to a number of uncomfortable symptoms, such as leakage of urine or feces, as well as a feeling of pressure or bulge in the pelvic region. This condition is known as pelvic floor dysfunction, and it can be caused by a variety of factors, including overmasturbation. If you are experiencing any symptoms of pelvic floor dysfunction, it is important to seek medical attention. A doctor can help determine the underlying cause of the problem and recommend the appropriate treatment options. Remember, while masturbation can be a normal and healthy part of a person's sexual activity, it is important to be aware of the potential risks and to take steps to protect your health and well-being. 4. Impotence. Many people believe that masturbation can lead to impotence or erectile dysfunction, but the truth is that there is no scientific evidence to support this claim. However, it is possible that masturbation can contribute to erectile dysfunction in some cases. This is because the repetitive stimulation of the genitals during masturbation can cause the nerves and blood vessels in the pelvic area to become desensitized. This can lead to a reduced ability to get or maintain an erection during sexual activity. Additionally, men who struggle with erectile dysfunction often experience feelings of shame and guilt, which can lead them to masturbate in secret. This can exacerbate the problem since they are not able to get the physical and psychological stimulation they need to maintain a healthy sexual function. If you are experiencing erectile dysfunction, it is important to seek help from a doctor or therapist. It can help you identify the underlying causes of the problem and develop a treatment plan that works for you. Remember, there are effective treatments available for erectile dysfunction, and seeking help is the first step towards a healthier sex life. 5. Prostate problems. Prostate problems are a common issue for many men, especially as they age. While there is no direct link between masturbation and prostate problems, it is possible that frequent masturbation may aggravate existing prostate issues. Prostate enlargement, also known as benign prostatic hyperplasia, can cause symptoms such as difficulty urinating, frequent urination, and incomplete bladder emptying. Some studies have suggested that men who masturbate frequently may be at a higher risk of developing prostate problems. However, more research is needed to establish a definitive link between the two. It is important for men with prostate problems or those at risk of developing them to speak to their healthcare provider about safe masturbation practices. In general, it is recommended that men with prostate issues limit their masturbation to a few times per week and avoid forceful or vigorous movements during self-pleasure. Additionally, maintaining a healthy diet, exercising regularly, and staying hydrated can help reduce the risk of prostate problems and improve overall sexual health. 6. Lack of sleep. Did you know that masturbation can affect your sleep? Well, it turns out that it can. When you masturbate, your body releases a surge of hormones, including dopamine and oxytocin, which can make it difficult to fall asleep. Additionally, the physical sensations and pleasure associated with masturbation can make it hard to relax and calm down, which are essential for a good night's sleep. According to a study published in the Journal of Sexual Medicine, men who masturbated within 30 minutes of bedtime were more likely to report sleep disturbances than those who did not masturbate before bed. However, it's important to note that this is just one study, and more research is needed to establish a definitive link between masturbation and sleep problems. If you are having trouble sleeping, it is important to consult with a healthcare professional to rule out any underlying medical conditions. You should also practice good sleep hygiene, such as establishing a regular sleep schedule, creating a relaxing bedtime routine, and avoiding caffeine and screen time before bed. Masturbation can be a normal and healthy part of a person's sexual activity, but it is important to be aware of the potential effects on your sleep and take steps to ensure that you are getting the rest you need. While masturbation can be a normal and healthy part of a person's sexual activity, it is important to be aware of the potential risks and side effects. Overmasturbation can lead to a loss of sexual interest in partners, health issues, weakened muscles, impotence, and prostate problems. It is important to masturbate in moderation and listen to your body's cues and seek professional help. If you are experiencing any negative effects, masturbation should be a pleasurable and enjoyable experience. Thank you for watching today's video. We hope that you have learned something new and informative. Please remember to like and share for more informative content. Stay healthy and take care.